Bismillahirrahmanirrahim. This presentation is regarding pneumoperitoneum. Word pneumo means air and pneumoperitoneum means air in the peritoneum. Peritoneum does not contain air. Air is inside the gut, stomach, a small gut, large gut, anus, rectum. Air, when it comes out of the gut, it can enter the peritoneum. So this is known as free gas under the diaphragm. Gas being lighter rises up to the highest level up to the diaphragm and gets arrested at the diaphragm. So what you see is gas under the diaphragm. Fluid being heavier will settle down due to gravity. Now, what is important when a patient comes with abdominal pain, when you are taking x-rays, always include a chest x-ray along with the x-ray abdomen, because free gas under diaphragm is readily seen in a chest x-ray. And a chest x-ray should also be taken in an upright posture. Now, to start with, I've got here 3 x-rays, number 1, number 2 and number 3. These are from the same patient, taken on the same time and date. Now this is a chest x-ray. Number 1 is a chest x-ray taken in an upright posture. Patient is standing up. So it includes chest and a part of the abdomen. And what you see here is gas under diaphragm. Now, where is the diaphragm? This is the diaphragm. And this is also the diaphragm. And what you see is this black shadow, which is gas. And that's white is the upper border of the liver. So there is a fairly moderate amount of gas beneath the diaphragm. So this is free gas. The gas has come out from the gut. And how does it come out from the gut? The gut has perforated. This may be a perforation in the duodenum due to a duodenal ulcer. It can be due to a perforation in a stomach, gastric ulcer. It can be related to large gut and a small gut, ileal perforation. Normally when the appendix perforate, you don't see gas under diaphragm because appendix does not contain a large amount of gas. Now in the picture 2, this is the same patient having where the abdomen has been x-rayed. And you can see again the diaphragm here and quite a substantial amount of gas under the diaphragm. This is the liver shadow. And these are intestinal shadows. So there is a collection of the gas under both the diaphragm, which is quite a moderate amount. Normally when the gas comes out of the gut, it forms a very crescentic shadow, small crescentic shadow. But as the time goes on and the more gas is leaking from the gut, the gas collection becomes much more than just the crescent. Now in this picture, X-ray, you can see the wall of the gut, outer border as well as inner border of the gut. You can also see it over here because the gut is now lying in the uh, pneumoperitoneum, and it also contains gas within it. So the wall of the gut becomes visible, and this is known as Wigler's sign. Wall of the gut becomes visible. This is known as Wigler's sign. This X-ray chest I have included. It's an abdominal X-ray along with mainly chest. Now this is not gas under diaphragm. There is a fluid level here on the left side, and there is a gas collection. This is not gas under diaphragm. This is a gas bubble in the stomach. So I have included this X-ray just to make you realize that what a gas bubble in the stomach appears like and what a free gas under diaphragm appears like. Now I come to more X-rays over here. This is a late presentation of gas, free gas under diaphragm, late presentation of pneumoperitoneum. This is the diaphragm, and there is quite a large amount of gas all over the place. If you see more carefully, the gas under the right diaphragm is communicating to the gas under the left diaphragm, and this communication is visible. There is a gas just beneath the central diaphragm. This is known as scapular sign. Very evident of perforation and pneumoperitoneum. And here again you see the wall of the gut visible, regular sign, because the gut has got now gas outside as well as within the lumen. Now the commonest cause of free gas under diaphragm is perforation in a duodenal ulcer. When the duodenal ulcer is present anteriorly in the wall of the duodenum, it perforates and the gas comes out and gets collected into the peritoneum. Here I am showing you a small gut. This is the part of the ileum. This patient also presented with her. This was a 46-year female who presented with pneumoperitoneum, and when she was operated, there was a perforation in the terminal ileum. This turned out to be histologically a malignant perforation. So here I stop. The important thing is, in a pneumoperitoneum, always get a erect chest X-ray along with the plain X-ray abdomen to see more clearly gas under the diaphragm, regular signs, scapular signs, and the etiological factor. And always once you have done an X-ray, In an emergency, always try to read it out. Always try to see the film there and then. You don't have to see the film next day. Once you've done the X-ray, immediately see the film and make a diagnosis. If you are not sure of reading the X-ray, contact the radiologist. And don't wait for the radiologist report next day. Contact someone who knows about the X-ray. If you are an emergency doctor, not well versed with radiological science, and if you've done an X-ray in an emergency, always try to read it out with the help of your colleagues and make a diagnosis. Thank you. I stop over here.